Good afternoon, guys. Happy Easter to everyone. Here's the first show today. We're talking about hidden cause of falls after 60, why ankle mobility matters. Okay? The article argues that poor ankle mobility, not just weak muscles or vision changes, is a major and often overlooked contributor to falls in older adults. Below is a breakdown of the key ideas the page emphasizes. Why ankle mobility is so important. Ankle mobility refers to how freely the ankle joint can move through its full range of motion. According to the article, this small joint plays an outsized role in balance, posture control, quick adjustments to uneven surfaces, preventing trips and slips. When ankle movement is limited, the body has to compensate using the knees, hips, or trunk. But those joints are slower and less precise. That compensation reduces stability and increases fall risk. What happens when ankle mobility declines? The page explains that reduced ankle flexibility is linked to weaker balance control, slower reaction to loss of balance, higher likelihood of falls in older adults. This is because the ankles are the first line of defense. When your body senses you're tripping or shifting, if they can't respond quickly to fully, the whole balance system becomes less effective. Why ankle mobility declines with age? The article points to several contributors. Natural aging, joints stiffen, tissues lose elasticity. Inactivity, less movement means less range of motion. Lack of stretching, the joint becomes progressively tighter. Wear and tear, decades of use, reduce mobility and control. Over time, these factors combine to limit how well the ankle can stabilize the body. The big takeaway: The page's central message is that ankle mobility is critical and flexible piece of fall prevention. While people often focus on strength training or vision checks, improving ankle flexibility and control may be just as important, folks. For staying steady and reducing fall risks after 60. Now we're gonna discuss for some of the show this morning or this afternoon. We're gonna discuss gait disorders in older adults. Okay, based directly on the content of the page you're viewing. What the page means by gait disorders in older adults. The page explains that gait disorders are problems with the way a person walks, changes in speed, smoothness, balance, symmetry, or the ability to start and continue walking. These changes matter because walking is central to independence. Getting up from a chair, turning, navigating a kitchen, shopping, or moving around the home. The article breaks the topic into several key areas. Normal age-related changes in gait. Not every change in walking is a sign of disease. The page highlights several normal shifts that happen with age. Walking speed stays stable until 70, then gradually slows. Step length shortens, often due to weaker calf muscles. Cadence, steps per minute, stays the same. People keep their natural rhythm. More time with both feet on the ground, double double stance to feel stable, especially on uneven or slippery surfaces. Posture shifts slightly with more pelvic rotation and increased lower back curve. Feet turn outward a bit, likely for stability. Foot clearance stays normal. Older adults don't automatically drag their feet. These changes alone don't necessarily indicate a disorder. Abnormal gait changes. The page then describes patterns that signal a gait disorder, often linked to neurologic, muscular, or orthopedic problems. Examples include asymmetry. One side moves differently, e.g., limping from hip or ankle pain, loss of symmetry, arms and legs don't move in a smooth rhythm, difficulty starting or continuing walking, feet feel stuck, common in Parkinson's disease or normal pressure hydrocephalus, freezing or scuffling, often linked to neurologic disease or nerve damage, retropulsation, stepping or falling backward intentionally, foot drop, toes drag because the front of the foot can't lift, short step length, often due to fear of falling or weakness, wide-based gait, suggests knee, hip issues, or cerebral problems. Circumduction, swinging the leg in an arc to compensate for weakness or stiffness. Forward lean or festination, common in Parkinson's disease. Reduced arm swing, seen in Parkinson's disease or vascular dementia. Each pattern gives clues about the underlying cause. How gait disorders are evaluated. The page emphasizes a holistic assessment, talking with the person about fears, falls, and goals, observing walking with and without assistive devices, checking step length, cadence, symmetry, and intention, assessing strength, especially calves and thighs. Asking about daily tasks, stairs, bathing, cooking, shopping, using imaging, CT, MRI, when brain or spine disorders are suspected. The goal is to identify all contributing factors, not just one. Treatment options. Treatment depends on the cause and the person's goals. The page highlights strength training, leg press, chair raises with weights, step ups, stair climbing. Especially helpful for frail adults or those with arthritis. Nordic walking uses poles to engage arms and torso, increases step length and speed, requires training for safety. Balance training, static posture, weight shifting, single laid stance. Dramatic dynamic, tai chi, tandem walking, backward walking, slow lunges, dance-like movements, assistive devices. Canes for knee and hip pain or neuropathy. Walkers for stability, especially forward fall prevention or protection. Proper height and training are essential. Prevention. The page is very clear. Physical activity is the strongest protection against gait decline. Daily walking 30 minutes maintains mobility. Okay, guys, so that is your A for today. I'll be back on later tonight for shows. Until then, Gator Wellness, take care, folks. Have a good Easter.